So I'm just going to give you a few of my tips, some things that I've thought of or that I've picked up along the way about applying for medical school, really. I think choosing your medical school is a really important step, of course, in this process. I know it's sort of easy to think, any medical school is a medical school, but I think there is variation between all of them, and choosing one that suits you in the best way is worth taking some time to sort of deliberate. I think attending open days is a really good way to get a feel for the university. Different universities have, different courses going on. So, for example, I'm at King's and we have the humanities and the arts, and we also, of course, have our medical school and sciences. But then other institutions are purely science-based. So, considering these things beforehand might just be a small constituent of your consideration, but definitely worth considering. And also the open days help you get a feel for the university life, what campus life is like. So it's definitely worth taking the time to go and visit, see what you get, like what kind of feeling you get from the university. That will definitely help to guide your decision making. But also different universities place emphasis on different components of your application. So, GCSEs, UCAT, different universities will look at all of these things with different weightings. So I think it's important to play to your strengths as well. So you're going to be spending, 6 years there. So of course, make sure it's the right university, but at the same time, you need to weigh up where the strengths in your own application lies. If you have really strong GCSEs, then it's worth looking at a university that places more emphasis on those, because you're sort of increasing your chances according to what the university is saying. And I also think part of choosing your medical school is deciding what kind of teaching methods you like. So traditionally, you kind of divide your medical schools into problem-based learning medical schools and traditional kind of medical schools, which will be, lectures, etc. Whereas problem-based learning is taking more of a case-based approach. So you look at a patient, talk about it, dynamically, holistically, and learn medicine more in that way. So having an idea which of those is you're better suited to is a good way to go about choosing a medical school, in my opinion. And also it's other small things that might not be major considerations for you, but just things to have in the back of your mind. Some medical schools do dissection, some do prosection. So if you're more of an interactive vocational learner, then maybe dissection is something that you'd really like to do in your first year. Maybe you think that will be the way that you will best learn anatomy. So it's worth considering if you'll have the opportunity to do that. At King's, we have dissection in first year, and I thought it was a fantastic opportunity to learn anatomy in a very visual way, by actually doing the dissection yourself and talking through it with somebody who's very experienced. So just something else to keep in the back of your mind.